Most people, probably about 80% of the people that are walking around today will have low back pain that is disabling at some point in their life. Now, disabling, what I mean by that is they're not able to do their normal activities in the way that they would normally be able to do those. And they might be limited from doing things around the house. They might be impaired so much that they miss work. Low back pain can really affect how well a person enjoys their life and what they're able to do in their life.
What are some low back pain options? You're obviously a chiropractor, but the thing that intrigues me a bit is the acupuncture side, and it's been proven that acupuncture can be very effective with low back pain. So where would you start with someone who comes in presenting with low back pain?
That is a great question, because one of the things we do here at our office is try to find what is the best possible solution, what are the best recommendations we can make for each individual patient. When we do a consultation, the patient will come and sit in the very chair you're sitting in right now, and they will tell me what their story is, what kind of problem they're having, how long they've been having it, what might have caused it, what they've already tried in terms of trying to find relief for it. And then depending on what we learn from that, then we may proceed, and often do proceed, to do a physical examination, may do other testing to try to find out, number one, what is the cause of the problem they're having, particularly lower back pain. It can be caused by a number of different things, and the success of any possible solution really depends on matching that solution with the cause of the problem. One of the reasons that we offer acupuncture here in this office is because it has been found to be so effective for low back pain, for headaches, for neck pain, for shoulder, hip, and knee problems and things like that. And in multiple studies, particularly one of the most recent studies performed in Germany with over 1,000 patients, found that acupuncture was almost twice as effective as traditional care for back pain. And the improvements lasted longer than anything that they could have taken, particularly from medicines, things like that, to relieve pain. Now, in this office, we also have chiropractic as an option. The chiropractic treatment, particularly for lower back pain, is a treatment called flexion distraction. It is a very, very comfortable procedure in which the lower back is actually stretched to some degree, and then while they're in this position with the back stretched, we manipulate the tissues in a way that it helps the joints to move more completely, more freely, and it's surprisingly very, very comfortable for patients. A lot of times people, if their back's already hurting, they're hesitant to have anybody do any kinds of treatment that might actually be hands-on or manipulative. But what we've seen is, if the patient can make it into the office and crawl up on the table, they can tolerate the treatment very, very well. It's a very, very easy thing to do. And we also offer rehab training. For example, sometimes patients have weaknesses or deconditioning in certain areas that are affecting them. We want to try to find that, locate that, help them get stronger, and improve their strength, improve their flexibility. We also offer opportunity to sit and discuss, and in most cases we will discuss with patients things they might be doing on their own time that is making their problem worse, certain activities they might be doing, or ways they can change their activities, ways they can change their work activities or their home activities, so they're least likely to encounter further back problems.
The back pain study is pretty interesting, the acupuncture study in Germany. So with that being said, it's best to come in and just let you take a look at here's the problem. It may be a combination of chiropractic and acupuncture. It's very individual, isn't it? The approach that you take with each patient.
Brian, that is a great point, because not everybody will respond to any particular treatment for any type of problem. Not everybody is going to be a good candidate for acupuncture. Not everybody is going to be a good candidate for chiropractic care, even our gentle, well-tolerated chiropractic care. Not everybody is going to be a good candidate for exercise. And certainly not everyone is a good candidate for some of the medications that are available with the side effects that are a concern. And so the most important thing for us is to try to match the right treatment with the right patient, so that person has an improved chance of responding well to that treatment.
So call today, 895-1253, and make an appointment with Dr. Mark Kestner here at Kestner Chiropractic and Acupuncture Center. They're on Broad Street, across from Alexander Chevy.